to invite Ananya to introduce Professor Ahmedullah Sharif. So Ananya Bhattacharya is a first year student in Mahatma Gandhi Medical College. As you can see, the first years in this college are really vibrant and raring to go. And they are going to be looking after us when we grow old. So she has trained Bharatanatyam dancer and has trained consistently for 15 years. And as you can imagine, she thinks that it has given her the necessary resilience and diligence to be a good doctor. And her other interests are swimming and reading. And she loves Agatha Christie like me. I couldn't believe that kids of this generation also read Agatha Christie. She has a growing interest in oncology, but she's actually waiting to explore. And like Dr. Sridhar says, she's going to try it all and then figure out what she wants to do. Please give a big hand to Ananya.
Good morning, everyone. It is my distinct honor to introduce a highly esteemed figure in the field of medical science, Dr. A. Sharif. Dr. Sharif is currently a professor and head of Department of Anatomy at the All Indian Institute of Medical Sciences, New Delhi. With a medical career spanning several decades, he has made significant contributions to both medical education and research. Dr. Sharif obtained his MBBS and MS degree from JIPMER Pondicherry in 1986 and 1989, respectively. He has since established himself as a pioneering researcher, particularly in the areas of clinical ecotoxicology, heavy metal toxicity, and the development and plasticity of enteric nervous system. His work has led to the development of the state-of-the-art facilities at AIIMS, including the first clinical ecotoxicology research and diagnostic facility in the entire country. Among his many accomplishments, Dr. Sharif has standardized histological processing techniques, established neural tissue culture laboratories, and developed digital image analysis labs. His innovative research on fluoride toxicity and heavy metals has earned him national and international recognition. Dr. Sharif's dedication to advancing medical sciences is further exemplified by his role in developing e-learning resources and implementing a learning management system at AIIMS. His research has been widely published, and he continues to mentor the next generation of medical students. Please join me in welcoming Dr. Sharif.
Good morning, all of you. First of all, I thank Ananya for the kind introduction, and I thank Dr. Radhakrishna and Vidya, the founders of Marvelous Medicine, and my class fellows in MBBS. So I am very proud that I have been invited to this first episode of Marvelous Medicine on Wheels, and I wish this continues and reaches as many medical colleges as possible. So thanks to Radha Krishna. I think he's known to everybody as Patta. So for us, he is Radha Krishna. Right. So thank you once again. And thanks to Mahatma Gandhi Medical College for entertaining us. Okay, so it is a difficult task to talk about anatomy, which is almost a dead subject, after a glamorous and beautiful talk and humorous talk by Dr. Sridhar here. So, but anyway, I'll try. So today I am not supposed to talk much about anatomy, but about the AI and the technology, which are the buzzwords now. Okay. So yeah, many people keep asking me why I took anatomy. Actually, I wanted to do everything from B to Z. It's like if you are very busy as a clinician or a surgeon, there will be hardly any time to do everything else. And I thought that anatomy is the best thing. It's a kind of a 9-to-5 job, and after that you can do a lot of things. And in fact, I have done a lot of things other than anatomy. We are fond of trekking. I'm keen in photography and IT. In fact, I was heading the IT division of AIIMS along with the anatomy department. So, and it is the IT which kept us afloat during the COVID. So I think so. COVID, one of the good things that happened during COVID was that IT got the boost and the acceptability, which was not there before. And I think everybody became familiar with the online video meetings and Zoom after COVID. So even bad things have some good side effects. Okay. So I think it is that technology has been my passion right from MBBS days. So this is where I ended up. So now in today's talk, I'm just going to touch very briefly, because it's supposed to be a very short talk of 15 minutes. I'll touch very briefly about the technologies. That is only two types of technologies. That is artificial intelligence and VR and AR. I think when we say other modern technologies, probably we are referring to the virtual reality and augmented reality. Question is, after the advent of AI, a lot of people started losing jobs, particularly the software professionals, because the AI is helping the software professionals. Like one programmer can do a job of 10 programmers. So 9 of them are laid off. So now everybody is thinking, because AI is, getting into all the fields, right? From, the space shuttle and maybe up to the spittoons are all AI enabled, washing machine, this thing, that thing, everything. So now a lot of people are worried about, sometimes people are also asking, after these robotic surgeries, are the robots going to operate, and are the surgeons going to become irrelevant? So this is the question everybody is asking. So now, same question we can ask as anatomists also. After this AI, VR and AR, is it going to replace the anatomy as it was being taught and learned over the decades? The human cadaveric dissections. So are they going to be replaced by AR and VR? This is the question. So let us see what is the fate of us anatomists, and whether the cadaveric dissection is still very much there. In AIMS, we don't have any dearth of cadavers, so we give one cadaver for every 8 to 10 students. So cadaveric dissection is very much alive. So what exactly is this AI? Artificial intelligence is the intelligence of machines and softwares, as opposed to the intelligence of the humans or animals. Okay, animal intelligence is also natural intelligence. So now everybody seems to be scared of artificial intelligence. Is it going to take over? Is it going to, terminate the humanity or something like that? No, because all those apocalypse type of movies that we have seen. So now everybody is thinking that we should be scared of artificial intelligence. I think somebody has famously said that it is not the artificial intelligence that we need to be scared of, it is the natural stupidity. So I think it is now, if a stupid person can misuse the artificial intelligence and do harm to the humans, not the artificial intelligence by itself. Okay, so what is the difference between AI and natural intelligence? That is the human intelligence. The AI lacks consciousness, it lacks emotions, and it lacks creativity. I think this is what you should remember. These are what make us human, and we will always be superior, so we don't have to worry. Now we'll just see what are the features of artificial intelligence. It can learn the patterns from information. It can deal with a lot of information, a lot more than what we humans can deal with. In fact, to be human, we don't require that much information. But the artificial intelligence requires a lot of information, and it will try to learn patterns from that information. And because of the information overload, now artificial intelligence and in fact the statistical sciences have come of age. So voluminous data is what is required for good artificial intelligence. And it combines large data sets with intuitive processing algorithms, and it can manipulate the algorithms. For example, we give an algorithm and it can keep going over and over again and actually manipulate the algorithm itself. And it can learn some kind of behavior patterns, and it can solve problems and suggest outcomes, and this can improve over time. Continuous reiterations of that same program will give better and better results. So these are the features of artificial intelligence. And what are the main tools? You heard of machine learning, okay? Machine learning is based on algorithms. You keep giving an algorithm and then keep giving the problems to the machine, and it will keep solving based on the algorithms. And then it is the statistical methodologies which are being generally used in those algorithms, and that is called machine learning. And then there is something called deep learning. This deep learning is based on artificial neural networks. These artificial neural networks, they try to simulate the workings of the neurons in our own brains. What exactly can a neuron do? We have millions of neurons connected to each other. What is each neuron doing? Each neuron can generate a signal and pass it on to the next neuron, and the next neuron can modify that signal and pass it further on. It can either amplify or reduce the intensity of the signal, and pass it on, or not pass it on at all. No, these are the three things: pass on as such, amplify, and pass on or not pass on it. So now that means depending on from where it is coming. So if they try to emulate this in software. I think all of you must have worked in Excel sheets or any spreadsheets. So you must have written formulae, right? Like one cell can take an input from another cell and do some processing on it and put the output in a third cell. Okay, now the intermediate cell can introduce a bias, and we can also encode some kind of weightage to the input, and then add some bias and do some processing and then output there. So now the neural networks, that's what our brain is doing, and the neural networks try to emulate that. So let us just try to see what exactly these deep neural networks look like. So there are multiple layers. There is an input layer and there is an output layer, and the signal is passed on to the input layer, and there is a processing going on by the hidden layers, and there is an output layer. So now the hidden layers can have these biases and weightages and all those kind of things, and those biases and weightages can be tweaked until we get a specific output for a specific input. Okay, if you show a picture of a cat, and if it can say that this is cat, in the beginning it may not be able to say, but you keep on tweaking the biases and inputs in the hidden layers. This is what exactly a deep neural network is doing. And now all the artificial intelligence, as we know right now, which is actually powering all the large language models and the chat GPT, are all based on these deep neural networks. Okay, so I think this is the crux of the whole issue. And now, do you think that there is any intelligence in this? No, not in the conventional terms of the human intelligence. And there are various types of artificial intelligence, weak or narrow AI, and it can perform a dedicated task. And then there is a general AI. General AI is supposed to be able to perform any kind of task. And we are not yet there. We don't have the artificial general intelligence yet. And then the super AI is supposed to perform anything, even the stuff that humans cannot deal with. And that is called super AI. That is there only in science fiction movies. Okay? Based on the functionality, the artificial intelligence can be classified into reactive machines, very basic type of artificial intelligence, and they focus on current scenarios. It's like that Deep Blue computer of the IBM, which has beaten the chess player and all those things. Oh, that is kind of this. And then there are some other systems with limited memory. So they have like the self-driving cars. Actually, they can actually observe the road and then try to remember this particular vehicle, that pedestrian and all those things, and navigate through. And those have a limited memory. And then there is a generative artificial intelligence, and that is what is powering the chat GPT and other virtual assistants. Okay. So generative tools are the ones which are the current buzz in the whole of the artificial intelligence system. And I'm sure, how many of you have used chat GPT or Copilot? Good, quite a few. So now you know exactly. So after using this chat GPT, now are you scared that it is going to replace the human teachers or whatever, the education system as we know of? No, it is not going to. But it can be a very good servant. And that's what humans are always good at. They take the most powerful of the technologies and make them their servants, right? So it's good to have a servant like that. So these are called large language models, and they take all the languages of the world, and they try to get patterns from that. I think all of us know these auto completion and spell checkers and all those things. Whenever we start typing one or two letters, the next word is suggested. So ChatGPT is nothing but the same thing scaled up to the level of phrases, sentences, and paragraphs. Okay, if you write one sentence, all the related and close sentences will be suggested by that. It's just a very highly scaled up model of the auto completion system. So virtual assistants and chatbots are the ones which we have to make use of, and I think every intelligent person will start using them. What can they do? What did you use ChatGPT for? You give it a prompt. For example, the worst part of teaching job is to set the question papers and evaluate them. And probably we can use ChatGPT now, make 10 MCQs on something. And then it will start making, and we can keep editing those things. So these are the things that generative virtual assistants can do easily. And one of the problems that everybody is worried is that using ChatGPT, the students may cheat. That is a real problem, and many schools, including in UK, have banned the use of ChatGPT. In fact, the suggestion is that you should actually use ChatGPT to curb that own problem. Because ChatGPT can always recognize whether something is actually produced by ChatGPT. So that is the current thinking, instead of actually banning it. So these are all the things that it can do. It can do literature review for you. It can summarize an article. If you don't have time to read the whole article, you can just give it to ChatGPT and say, give me a 4-line summary of this. It can do that. And it can evaluate. You can actually conduct exams and papers. Yeah. Okay, how exactly are these things working? All the words are actually vectorized. They have numerical values which are called vectors. Just like in the Google Maps, every place has got a latitude and longitude. Based on the latitude and longitude, we can know the interrelationships of two places, whether Mahatma Gandhi Medical College is closer to Kadalur or Pondicherry, all these kind of things. So similarly, words also are converted into vectors, and these vectors can be multi-dimensional. We people have difficulty understanding things if they are more than 3 or 4 dimensions. But computers don't have any such problem. No, the thousands of dimensions can be there in these vector spaces. So now this is how the computers really don't understand the meaning of the word. Okay, they are only seeing the interrelationship of the words in the space. Okay, and it is also possible to do vector arithmetic on that. We can do addition, subtraction, multiplication, and all those kind of things. So this is how the generative artificial intelligence is working. Right? This is the crux, and I think this is the most important part of this talk today. Now, there can be problems. Like, in AIIMS, Delhi, anybody who comes from a nearby village thinks that every male person who works in AIIMS is a doctor and every female is a nurse. It doesn't matter whether that person is a technician or a sweeper or attendant or whatever it is. They all think that every male is a doctor and every female, even if, the professor and head of obstetrics gynecology, he thinks is a nurse. So now same kind of biases are there in languages. And those biases can creep into all the AI-based generative models. And this is what we should be aware of.
Running out of time.
Yeah.
I'm sorry.
Yeah, I think this is the end of that. So I think virtual reality and augmented reality, and you must have been familiar with, and there are some virtual dissection tables where 3D models are there in the table, and then you can keep on peeling out layers or whatever these things. And then immersive virtual realities use the head-mounted displays, and Oculus Quest 3 is probably one of the most affordable and one of the very good these things. And now virtual reality is based on these head-mounted sets, and these are also being used in surgical planning and intraoperative guidance, because the patient data can be overlaid on the real patient. The data can be based on CT and MRI images, and pre-operative planning can be done. Similarly, dissections can also be done in anatomy. And in surgery, intraoperative, there are some applications where intraoperative guidance is also obtained using virtual reality systems. So I think these are the next step, and these probably will not replace the dissection itself, but they can complement and they can supplement the cadaveric dissections. There are so many of these, and you can just Google for. Now coming back to the question. So I posed this question to ChatGPT itself. I asked ChatGPT, can AI, VR and AR replace anatomy teachers and cadaveric dissection? And the answer is no. ChatGPT itself says that no, they cannot be replaced. And I think we agree with that. Yeah. Thank you.
Anybody? I thought this should at least have. There was this Hindi movie called recently where there's Teri Pyar, exactly. Tere Baaton Mein Uljha Jiya or something like that, where it's tongue in cheek about how the ideal wife can be. I mean, the robot is the ideal sort of partner in his life. He doesn't realize it, because she agrees with everything, does everything he wants. So clearly, that's not. I mean, the end of the movie show is not like that. So you have. Anybody has any questions till the stage is set? No? You're not a very interactive. This is not like a regular class. I think don't take it like that. This is your opportunity to interact. Yeah, go ahead. Very good.
I am Ram, studying in 4th year in MGMC, right?
Yeah.
My question is, what would be the end goal of AI in medicine, if not to replace doctors, as in, so?
Yeah. I think this is yeah. What is the end goal of artificial intelligence? The end goal of artificial intelligence is what humans want it to do. Okay, I think when Google came, lot of patients started Googling about their illnesses, and they come up to the doctor with a treatment. They will say that Google says this, and I think it was very normal for doctors to get irritated with that. Even I have seen on WhatsApp somewhere, a doctor had a notice, okay? After Googling, if a patient comes to him, your treatment and your prescription, your diagnosis and your prescription, 3,000 rupees. Okay, your diagnosis, my prescription, 1,000 rupee. My diagnosis and my prescription, 500 rupees. So ultimately, I think the artificial intelligence will be used and misused like any other technologies, and it is the misuse that we should be worried of. And artificial intelligence ultimate goal is to have a very capable servant. And you wish, your own secretary knows what is happening in your head. That you always keep thinking that why is she not able to read my thoughts? Kind of this thing. No, I think artificial intelligence probably wants, people want the AI to read their own thoughts and behave like a good servant. It will be a very good assistant. The humans will be humans because they are different. Like those three things, creativity, emotion, and whatever, sentiments. Those will never be there in artificial intelligence. You can rest assured. They may emulate, they may fake it, but it is not going to be there because it needs a human to feel. Machines can never feel. So we don't have to be worried.
You know, when we were doing our PG, we used to have this Index Medicus. You guys can just look on PubMed and get the whole thing. So it just speeds up things. So I think ChatGPT is here to stay. We should use it rather than worry about the, all the things that it can do. You guys don't have to do what we did. We had to go and open every year's cumulative Index Medicus and look for each topic just for a single thesis. And after 7 days, we were told, no, this topic is not good enough. You decide that in 3 seconds, you know. So I think it's just speeding up things.
On a practical level, try like this. If you have a set of investigations that you want to see in a patient, just feed it inside ChatGPT and it will give you the result in a few seconds. It's a good way of learning the process. It speeds up your way of learning. So use it as a tool, use it as a servant.
I request Ananya to felicitate Dr. Ahmedullah Sharif.
Thank you.